Nacional
in Mexico City. We're going to get our daily press conference started. This is number 81 on the COVID situation, this disease caused by SARS-CoV-2. Welcome. Good evening, everyone. Here we are again to update you on our epidemiological situation, both nationally and internationally. We're on day number 61 of our safe distancing campaign. We still have a full week next week to go with our national safe distancing campaign. We'd like to remind you that the actions for safe distancing don't end with the conclusion of our safe distancing campaign. But we're going to have a new regional situation that we're going to send to inform you about. And this is going to be defining what activities can begin again, depending on the color of the stoplight. We've had 84 evening conferences. This is number 84. The next slide shows you the international panorama. You can see the percentages have remained stable during the week. Even confirmed cases that have been confirmed over the last 14 days have stayed around 25%. We had seen a decrease in this percentage. We were at 50%, now we're at 25%. So we have about 5 days where this has been maintaining stability. So 1/4 of the cases confirmed with the onset of symptoms in the last 14 days are active. The percentages in America are the same. It is sort of toggling around 50%. There has been a significant decrease in Europe for the active pandemic, and now it's down to 25.3%. Let's take a look at the national figures. We have 210,070 people who have been tested. These are people who have been classified as suspect cases for COVID-19, and so they have been sampled to get tested. What does this process turn into? What does it translate into? 113,742 of these people who have been tested are negative. They have been confirmed to not have SARS-CoV-2, but 62,527 have been confirmed. These are the cumulative confirmed cases for people who do have COVID-19. We have 33,801 people who are suspected to have COVID, and we're waiting for the final results. There is about a fifth of the total confirmed active cases today, 13,347 people who tested positive and had the onset of symptoms in the last 14 days. This is the active epidemic in Mexico. And unfortunately, due to complications from COVID, very unfortunately, 6,989 people have lost their lives because of COVID-19 up to date, up to now. On our next slide, we can see the cumulative confirmed cases, and you can see them by state. More than half of our states have more than 1,000 cumulative cases. These are the cases that have accumulated since the beginning of the epidemic in Mexico. Nevertheless, we still have some cases that only have 3,000 accumulated cases. 48.9% is the incidence rate per 100,000 inhabitants in Mexico. Here we can see the distribution in descending order with total numbers represented on top of each bar graph. Here we have the map, and these are the active confirmed cases with the onset of symptoms in the last 14 days. This represents the active epidemic in Mexico. Here we can see that the majority of our states, around 70%, still have a range from about 100 to 500 cases. So the majority of states are right in that phase of the active pandemic, and we see very few dark colors on the map. Here is the information in descending order by state. You can see the darker color with the higher number of cases. This is the distribution by incidence, cumulative incidence rate. Just like we often talk about, we have the darker colors representing states that in the last 14 days, since May 20, up to May 22nd, have the highest rate of transmission. These are states that have maintained these characteristics. Some of them had darker colors just 1 week ago, and today now they're getting to a lighter color, which means that their burden of disease is lowering. But then other states are starting to be colored in with a darker shade of green, which tells you that the pandemic is not the same all over Mexico. Different states hit a peak at different moments. Some are on the rise, some are going down. So it depends at which phase they're at in the pandemic. Here's the information distributed by state, and you can see the first two states there that have had the highest number of cases there. We have Tabasco and Mexico City, and then Yucatan is in the third position. This is the distribution of the 6,989 people who died by their date of death. We can also see colored in light yellow. Those are the deaths that have still not been confirmed to be COVID. So they're waiting on their test results. So this number could go up. These are deaths. This is our distribution graph by state. This is the burden of disease and the deaths that have occurred since the beginning of the pandemic. So over on the top part of each bar, you can see that these are the suspected deaths. And that number will probably increase over the next few days once we have all those test results confirmed. This is the epi curve. The behavior has maintained itself to be fairly stable. And here, we want to remind you that this curve is of all cases in all of Mexico. So every state that hasn't had an increase over the last couple of days, it includes them. Others that have had a significant increase, it includes them as well. And so probably in June, we're going to see this epi curve moving at a different rate for each state, but it continues. It continues to be quite active. These are the confirmed cumulative cases. The increase for today, that is to say over the last 24 hours, is 5%. The cumulative burden of disease continues to improve. That 5% represents 2,960 new confirmed cases. And with the orange bars on the bottom, we can see the incidence. This is the load of cases over the last 24 hours, and you can see that it is maintained fairly stable, but now it's at the highest that it ever has been, and that's our follow-up on the epidemic. Let's take a look at occupancy rates and availability. 96%, that's the notification rate for the hospitals that are part of the COVID hospital reporting network. They are giving us all this information. You can see that occupancy rate for severe acute respiratory infection patients is at 39%. It's still not critical there. Up to the cutoff yesterday, it was 9,557 beds that were taken. And the total that we have available are 23,497 and 14,344 beds available for patients with severe acute respiratory infections. Here we see the occupancy rate percentages. They're very similar to yesterday. We have Mexico City, Guerrero, State of Mexico, Baja California, Sinaloa, Hidalgo, Veracruz, Puebla, Tabasco, and these states have 40% occupancy rate for their general beds, And this has been basically stable, very similar to yesterday's information. Here we can take a look at beds for patients who are critically ill. These are for patients who need a ventilator. So we have 64% in Mexico City at the occupancy rate there. And over on the right-hand side, we can see we have 35% for national occupancy. Mexico City is over there on the very left-hand side, and we have to remember that these percentages can happily go down when patients are released from the hospital. And this means that hospitals may have more availability for beds because they're reconverting beds that were for other patients. But what happens is they take them and turn them into beds to help with patients who have COVID. That's when we need more beds in the ICU. So we still have availability there. This also, if we see, we have 35% nationally, but it really depends on each state. If there's a state that has 5% and another state that has 64%, if we go to a hospital there, we see that some of them are almost full. And then there are other hospitals that aren't. So what's really important is this communication among the hospitals that are monitoring occupancy rates and taking people to hospitals where they can get a bed. Today is Friday, and just like we started on Friday last week, we said that we were going to update the information on laboratory diagnoses. Here we have our sample curve. This is the curve of sampling that has been done already. And you can see that there has been an increase not only in sampling, but in processing those samples. So if we walk down memory lane to our epi curve, you will see that this same trend is similar to that. We take samples for people who are suspected to have COVID. So when they're classified as having symptoms and perhaps people suspect they have COVID, then they're going to go into this graph as well. We have already processed 176,269 tests. Of those, they have been at one of the 31 state laboratories. And besides that, 70,000 have been carried out at other laboratories that also do epidemiological testing and that are in large cities with a high concentration of population. Remember that last week we told you that we had a little more than 100,000 tests available. Today, we have 413,452 tests available, and that's because we got 300,000 tests that we had bought about 20 days ago. So we have those now. Now they are available so that we can use them within our laboratory network in all of Mexico. The coordination is directly with IMINDE and state laboratories, and they have their communication lines permanently open. They ask for more, and INDRE, depending on how many have been processed, how many are positive, and how the suspected cases are going, then they send them 400, 600, or 1,000 tests at a time, so that laboratories will always have those materials available. This is how the percentage of the positivity rate has presented. On the bars in taupe, this is the number of tests that tested positive. And we've had more positive cases day after day. For example, in day 19, we had up almost 3,000 results. But it's interesting to take a look at this green line here and see the percentage of the positivity rate. And so that positivity rate has sort of stabilized since last week, 41, 40, 41, and then last week, 39. So we're going to see how the next week goes. That 39% might change because we still have Saturday and Sunday, and then we'll see what's going on there. But around 40, 41, that means of every 10 people who are developing systems of a respiratory disease, 4 of those are COVID, and the other 6 cases are could be some other respiratory illness such as influenza or viruses that are always circulating in the communities. But this is the information that we have for now. On my last slide, I'll show you the tests that have been done outside of our state network of laboratories. This is an important contribution that we can see that in the middle, these are the private labs, that 27% in the middle there. And so this is the information that they have given us up to the cutoff date on May 21st. They said they had tested people 30,472 times, and that number of tests had come out positive. We're just talking about positive tests here. We're not talking about cases or people who are confirmed to have the disease. So we can't really just take this information and add it on to what we show you day by day, because these are just positive results. So we don't know right now if those people were exhibiting or not exhibiting symptoms. If they were not exhibiting symptoms, then they would be classified as a carrier. That's someone else who we refer to as having COVID is a person who exhibits symptoms and gets sick from it, and they know that they're sick from it. But if someone is not exhibiting symptoms and doesn't develop the disease, they don't have COVID-19, because COVID-19 is the disease that produces SARS-CoV-2. Other people as well might have sought medical attention at other institutions. So there could be a duplicity here in some of these numbers. And like we commented today in the morning, this network of private laboratories that are validated by INDRE, they are putting into play a new system for reporting their results. With that new system, they will report on the person's full name of the patient and also what symptoms they're exhibiting. So with this new informative tool, we will have more information from private laboratories, and we'll be able to know what are the cases, and with the full name, we'll know that it's not duplicated in the institutional database, and then we'll be able to add that information to our general
Muchas gracias,
statistic of
doctor
cases
Alumia.
confirmed at the
Le pido
national
amablemente al
level.
maestro Zoe
Thank you,
Robledo si
Dr.
nos
Alumia.
presenta este importante
Now,
tema que
Dr.
hoy queremos
Mr. Zoe
compartir con
Robledo,
todos
if you
todos.
would
Claro que
present
sí,
our
doctor
information for
López
today
Gatell.
that we want
Muy
to
buenas
share with all
tardes
of you.
a todas,
Yes,
a
absolutely,
todos.
Dr. Lopez Gattel.
Déjenme
Good
contarles
afternoon
todos
to
los días
everyone.
a las 6 de la mañana
Let me
en
tell
mi gabinete
you
de seguridad
every
habitual
day at 6
que
a.m.
sostiene el
when
presidente
I'm
López Obrador
doing the
con el
security
equipo de seguridad.
information
Ya desde hace
report,
varias semanas
we
estamos
have our
integrados
president with his
en un gabinete y
security
gabinetes de
team.
salud. El
And for
doctor
the
Jorge
last couple
Alcocer,
of
el doctor
weeks, we
López
have
Gatell,
been including
su
the
servidor, el director del ISSSTE, el
Health
director
Council
del
on
ISAT.
this, Dr.
Pero
Alcocer,
adicionalmente a
Dr.
eso
Lopez
hay
Gattel, the
reuniones
director of
3 veces por
ISTE.
semana en la noche, donde vamos
These are
viendo la
meetings
evolución no
that we
solamente de la
hold
epidemia,
3
sino también
weeks, 3
las
times
acciones
per
que se están
week,
llevando a cabo en todo
and
el
where we
país,
not talk not only
incidencias y
about the
demás.
epidemic,
Es
but the
un
actions
seguimiento
that are
muy
being
puntual que ha
taken over
llevado
the
el
whole
presidente
in the
López
whole
Obrador.
country,
Les cuento todo
incidents
esto
and all of
porque
this.
el día de
This is
ayer,
something very
reunidos
important
aquí
that President
aquí
Lopez
en Palacio
Obrador
Nacional,
has done.
Surgió
we
esta
we
instrucción del
meet here in the
presidente que
National
había que
Palace,
hacer
and
este
something
reconocimiento
popped up. We
a los
got
médicos, médicas,
uh,
enfermeras, enfermeros,
the
todos
president
aquellos
tell
que han
that
formado
he wanted
parte de
to
los equipos
recognize
COVID. Es
doctors,
decir,
nurses,
son
all of
los
these healthcare
especialistas,
professionals
líderes de
who
los
are part
equipos,
of all
los
of these
médicos de
COVID
apoyo, que son de otras
teams,
especialidades o son
specialists,
médicos
leaders,
generales,
team
familiares y
leaders,
no familiares, como les
support
decimos en el
doctors, doctors, general doctors, family doctors, that's what we call them at the Mexican Social Security Institute, auxiliary nurses, they are also there in those support groups. Why them? A hospital is a massive community, but these are the people who have the highest burden right on their shoulders. They're the ones who are dealing directly with patients who have COVID. They have long shifts. They're these people we see with their faces marked up, but with pride from wearing their protective equipment on their faces. We designed something for them, for these health professionals. So here's this initiative that we have designed for these people. Here we go. We're talking about Miguel Hidalgo and Costilla, and this is a recognition. We have this in the Act of Civil Recompenses, and this has been in force since 1975. And we have other recognitions that the Mexican state awards to people. And this recognition has a couple of degrees. This recognition establishes why it's being given. And this is an award, well, this awards people who are eminent or distinguished with behavior and exemplary careers. And this is people who are dedicated to our homeland. This has been awarded on 10 different occasions, and this is the highest award and recognition that can be given to our compatriots. We have the Aztec eagle, which is the most important icon that is given to foreigners. This is the most important award that is given to Mexicans. This is an interesting thing. It hasn't been awarded very many times. It has been awarded to very, very distinguished people. To one doctor, in fact, to Ignacio Chavez. It has been given to Nicolás Bernal. It has given to 6 different people from the events of the 17th but there has to be an agreement on a national level that everyone says, yes, we want to recognize a group of people or a community of people for their actions. This award has different degrees. The first one is called the Collar degree, and this is for heroic acts. This is from people seeing exemplary behavior. The next grade is Cross, the next level. This is for extremely excellent behavior. And then we have another level, which is the Banda. This is for absolutely distinguished actions. And the last one is our place name. The last one is the highest level of this award. This award, according to the law, this is established by a council and by the Secretary, the Ministry of the Interior, the Chamber of Deputies, the Secretary of Public Education, the Senate of the Republic, and the Ministry of Culture. What we are proposing is this. We would like to give 58 awards, Miguel Hidalgo Awards. This is represented by a medal and 100,000 pesos, and this is for 58 doctors and nurses who have helped patients recover from COVID. These people will hand in they will seek this prize. Why 58? Because that was the age in when Miguel Hidalgo lost his life. The second level, the Cross level, this will be given to 500 doctors and nurses, but here they will be nominated by their community. This is especially for doctors and nurses who work at hospitals that have been retrofitted to deal with COVID patients and have the highest number number of patients at their hospitals, and they'll be nominated by their community members. So here it's for 500 doctors, and it's with the medal and 50,000 pesos. Then the same Miguel Hidalgo Award, Banda level, this is 30,000 pesos for 1,000 doctors and nurses who are part of COVID teams, and they will be nominated by their own hospitals for their exemplary behavior and conduct. This means it's not necessarily hospitals that have the highest productivity and the most intensity in terms of COVID cases, but these are for people who are exemplary people, who have done things, extraordinary things, totally out of what is normally asked of them. And that's why we're thinking of 1,000 people. And then lastly, we have the highest level, and this will come with a metal plaque and 25,000 pesos. And this is for an COVID team. This is usually 16 people, one specialist doctor who's a leader, 3 support doctors who could be general doctors or from other specialties, family doctors as well, and then the nursing staff, specialist nurses, general nurses, and auxiliary nurses. This is a team of about 16 people. This is the traditional COVID team at the Mexican Social Security Institute. Some teams have a couple more people or a couple fewer people, but this is an award for a team. That's why we're thinking of 7,500 COVID teams that are at hospitals that have been retrofitted for COVID. Here we're talking about every single institution: social service, ISSSTE, ISFAM, Social Security for the Armed Forces, as well as Pemex and INSABI. All the healthcare professionals are eligible to be nominated. I would like to tell you about the next steps here. The Health Cabinet, headed by Dr. Alcocer, will ask the Council to consider this. And we'll do that through the Ministry of the Interior and its Council. And they will be the ones that will be giving over these recognitions. Once they have received the information, you could send that in today if you wanted. Then we are going to have a call for people to hand in nominations. So it could even be patients who have received treatment for COVID and recovered. They think, someone did something for an exemplary fashion. And there could be some other nominations from the communities within the hospitals. And that's how we do the selecting process for these exemplary cases. I'd like to tell you that our intention here is for us to be able to give these awards very soon. It's not just about the money, which is also important, but it's about recognizing it's about the Mexican state recognizing its people, its workers, its healthcare professionals. And we just had a comment from our president that our resources for these awards will come from funds from the Institute to give back what has been stolen from them. So if someone has stolen something and auctioned it off, what better way than to use that money to give to our healthcare professionals and recognize them for their work? But it's also about recognizing Mexicans with the highest distinction available in our country. This is the highest distinction for our greatest Mexicans, public servants, our most exceptional public servants that we've seen the last years. Thank you so much. Thank you so much, Dr. Soy Robledo, the General Director of the Mexican Social Security Institute. And just as Soy Robledo was saying, this is a proposal that comes directly from the president. We immediately said yes, and so did everyone. It wasn't just people in healthcare. The whole work group said, we are happy to coordinate this.
We are very aware of what people are living and all of our healthcare providers that
Para
are going through,
nosotros,
hospitals in particular,
el nivel
who are
administrativo central,
directly into
pues tenemos
action.
nuestras particularidades en el campo de trabajo, pero
For
en todo
us,
momento estamos conscientes de lo que implica
the main central for
la
activities would
confrontación
be
con una realidad
gathered
muy
from the
compleja,
field
muy
work, but we're
difícil, muy
very aware at all
estresante,
times
como lo hemos
of
señalado
what does it
repetidamente
imply
aquí.
to
Hace
deal with a
unas
very
pocas semanas
complex and
tuvimos nuestros
harsh reality,
colegas
just
del
like
tema de
we
salud
have
mental
signaled
que
it
hablaron
before
precisamente de la
a couple of
importancia de
weeks
cuidar
ago
a
when
quienes
our
nos cuidan.
colleagues
Y este
from mental health
reconocimiento
department were here,
en su
and they
momento
were
sabemos
just
que
giving us
cualquier
some highlights on how
forma o
important it
expresión de
is to
reconocimiento
take care of those who
pudiera tener sus límites,
to take
pero
care of
nos
those who
parece
take care of
fundamental
us.
y le
And
parece
at a
fundamental al
given time,
presidente y
we're sure
coincidimos
that these can
absolutamente con
have
él
their own
que toda
limits,
la
but
sociedad
we
debe
find it
tener claro
very important
a estas
and
personas
also think
heroicas
so, and we
que
agree
nos han
completely that we
cuidado y nos
should
siguen
all be
cuidando todo
aware
este momento.
that
Por
these
eso es
people
este
are
reconocimiento.
heroes
Y conforme esto
and they
vaya
have been taking
transcurriendo,
care of
pues se
us.
irán dando
And this is why we extend
detalles.
this
Y quiero
recognition.
destacar
And
también
as
la
time goes
importancia que el
by,
maestro Zoe Robledo
we
sea
will
quien
fill you
fue
in
designado por
on
la
the
propuesta del secretario de
details.
Salud,
I would also
por
like
supuesto
to
con el respaldo del
emphasize
presidente
on
y con el
what Mr.
consenso de
Robledo
todos
said,
nosotros,
which was
como
assigned
quien
based on the Ministry
fuera
of Health
la
and the
persona
backup of the
encargada de
President
coordinar
and
esto y
our
hacer
common
una
agreement,
propuesta estructurada,
that
la
he
cual, bueno, de
should be
manera inmediata
the
ya supe
person
que
in
la
charge
presentó esta
of
mañana
coordinating
en el gabinete
this
de seguridad. Le
action
agradezco
and
también
to develop
enormemente.
and structure
Gracias, maestro. Pues vamos a pasar
for it
entonces a la
and in terms to
sección
look
de
after
preguntas y
the safety
respuestas. Vamos a
cabinet.
empezar con Carlos, con Bianca, con usted,
We will
con
now
usted por
turn to
acá,
the
y nos
Q&A
vamos Dulce Soto,
rounds.
y aquí
We
nos
will
vamos.
begin with Ms.
Adelante.
Bianca,
Buenas noches
you,
para todos.
you,
Primera
and then
pregunta para el maestro
after
Zoe, si nos puede dar
that with you,
detalles.
Ms.
Ya
Soto,
mencionaba
and that will be
este
it.
reconocimiento merecidísimo para los profesionales de la
Dr.
salud.
Zoe,
¿Cómo se va a entregar de forma
can
a
you
partir
give
del día de
us details
mañana?
on
¿Se va a entregar
this
en una ceremonia
highly deserved
global, así
recognition
con
for
el
all these
presidente de la
healthcare
República aquí en
workers?
Palacio
Would
Nacional?
it
¿Cómo
be
va a ser la
on
entrega de
tomorrow? Would it
este
be a
reconocimiento?
global
Gracias.
ceremony with the
Sí, muchas
president
gracias,
here at
Carlos.
National Palace? Or
Todavía
how is it going
tenemos
to
que
work?
terminar de definir esos detalles. No, no sería a partir de mañana. Todavía se tiene que convocar a la reunión de
We'll
este
still have some
consejo.
details to
Son
go
cosas muy
through.
rápidas, en realidad.
We still have to
El
ask
planteamiento es
for it
que pudiera
and for some
estar la
details.
primera entrega para los
Our main
médicos
statement
del
is
INSAM, es decir, de las
that
enfermeras, el
we
1 de
should
junio.
probably
Esa
perform this
sería
first recognition
la
for
primera
the
entrega de las
Army
condecoraciones
Forces
para el
on June
personal de estas
1st.
instituciones y
That
después
would be
la
our
seguridad
first
social,
stage of
Pemex,
recognition for
el
this
ISSSTE,
personnel
nosotros en
for the
el lado
healthcare workers of
social y
institutes.
después el
And then
ISABI.
next
Pero
would
como lo ha
be
dicho el doctor
ISTE,
López-Gatell,
of
vamos a
course,
seguir dando
and
detalles
lastly,
al
INSABI.
respecto en los próximos
But as
días.
Dr. Gattel has
Yo sé
mentioned,
que a
we
lo mejor
will
tiene el tema
fill you
preparado.
in the
Si nos
details in
puede
the
traer
upcoming
para
days.
la otra intervención que lo invite el maestro, el doctor Gatel, este procedimiento que están efectuando en el
You
Seguro Social
might
con
not
plasma
be having
es
this
muy
data at
prometedor,
hand right away,
muy
but probably next
interesante
time.
precisamente lo que se
This
está haciendo
procedure that you're
y
doing
creo
in
que es
with
importante que la
plasma,
gente lo conozca, devele
it
mitos.
looks very
Obviamente ya
promising
sé que
actually, and I find
la
it
idea
really
pues es este
interesting. I
reconocimiento,
believe it's
pero
worth
ojalá y nos
people
pueda en alguna
knowing,
otra oportunidad traer esta parte, a ver si lo invita
and
el doctor
we
Gatel.
definitely
Y
need to
la
find
tercera para el doctor Gatel, si
something
nos puede hablar un poco
to
de
actually
calendario que
highlight
se va a
that.
poner ya en vigencia, bueno, este semáforo
And my
del 1 de
second
junio.
question is,
Ayer hubo
Doctor,
junta precisamente con el Consejo
this
aquí
stoplight that's
en
going to
Palacio Nacional,
be
muy noche.
implemented on June
Estamos ahí
1st,
viendo las fotografías que bastante noche salieron ustedes de aquí de Palacio Nacional. Si nos puede hablar un poco de los avances que ya se tienen o de lo que ya se ha
and from the
ajustado
past few
respecto a
days,
este
we have heard what
semáforo que se va
are
a poner en
the
marcha este 1 de junio.
upcomings
Gracias.
Con mucho
of
gusto.
this
Efectivamente,
stoplight
al menos
and what are the details for it to be
2 a 3
implemented.
veces por semana,
Well,
además de
gladly,
las otras reuniones que tenemos diarias
we
o
are
varias
thinking
veces al
that
día
it would
con los
be at least
distintos
2
grupos de
to
trabajo,
3
con el
days in
Comando
the
Operativo
upcoming
COVID
days
que tiene el
with the
mando
different work
unificado
groups that we
de
have
todas las
for the
instituciones
COVID
federales que
operation
trabajamos en COVID.
and that are
Tenemos
holding a single
varias otras
command
reuniones. Tenemos,
from
por
all
ejemplo,
federal
la de los
institutions that
martes
are working
con
on
las y los
COVID-19.
secretarios de
We
salud
do have
estatales
several other meetings,
y
like the
tenemos
ones we are
la
holding on
que 2
Tuesday
veces o 3 a
with
veces
the
a la
different
semana
state
con el
health
presidente
ministers,
y el propio
and
grupo
the
de
one
trabajo.
we
Esta fue la
keep
de ayer
having once or
por la
twice a
noche.
week with the
Lo
president,
que vemos en
with its
general
own
es
group,
el avance
which
de la
one's the one that
respuesta.
was held
Presentamos la
yesterday.
situación epidemiológica, estado por estado, ciudad
What
por
we have
ciudad.
seen so far
Presentamos las
is the
proyecciones
advancements of
de
the response
matemáticas
state by
que
state
nos
and city by
elaboran y
city,
siempre les agradecemos a las
and with the different
personas expertas en
mathematics
el campo
that we
académico de las
are
matemáticas
given
coordina el CONACYT, y también
from the
agradecemos
experts
a la
that
doctora
are
Dolores Builla.
performing in the fields of
Se
mathematics
presenta
and doctor,
el abastecimiento
along
de
with
insumos, se
CONACYT.
presenta la capacidad de
And
respuesta,
so we
la
can
ocupación
present
hospitalaria,
how much
el uso de los
they have
ventiladores,
in
se
existence
garantiza
in
que lleguen
stock,
los ventiladores,
hospital
etcétera. Es decir,
availability,
se pasa
bed
lista de todos y
availability,
cada uno
the
de
use of ventilators,
elementos
and we
y
enforce
los
the fact
pasos
that
a
they
seguir.
do get the
Ayer,
ventilators,
en
and that
concreto,
list from those
dado el
elements that we'll
semáforo
look
ya
into
fue
and what are the
discutido, ya
following
fue
steps.
delineado y ya fue
Specifically,
publicado en
yesterday,
el diario
since the
oficial,
stoplight was
en
already
el acuerdo secretarial del 14 de mayo,
outlined and it
ayer
was
no
already
entramos en
published in our
detalles
official
sobre el
diary
semáforo. Sin embargo, la
on May
pregunta es muy
14.
oportuna,
We
además de
did
importante,
not delve
porque
into any
hoy
details on
a
the
las
stoplight. However,
12 del
I
día
find it
lo que sí
very
tuvimos fue
important that
una
today,
videoconferencia con los
around
7 o 6
12 at
gobernadores
noon,
de la megalópolis
we
y la
did
jefa de
had a
gobierno, que
video
también la Ciudad
call
de
with
México es
the
parte de la
6 or
megalópolis.
7
Hidalgo,
governors
Tlaxcala, Puebla,
of the
Querétaro,
state and
Ciudad de México, Estado de
of the
México y
megalopolis,
Morelos.
as well as
Los
with
6
Dr.
gobernadores y
Sheinbaum.
la jefa de gobierno. Y conversamos sobre el semáforo. Entonces presentamos
That would
los
be 6
pormenores
governors
de
and
la iniciativa
the
de nueva
governor
normalidad,
of
de acuerdo a lo que está
Mexican state.
publicado en el
This
diario
is
oficial,
how we
y
presented the
los
details
detalles sobre
to
cuáles son
return to
los
our new
criterios que se
normality based
usarán
on
para
what
el
we published
semáforo.
in our official diary.
Enseguida el subsecretario
And
Ernesto Acevedo, subsecretario de
the
Industria y
details
Comercio,
of
habló de
what
algunos
is the
detalles que tienen que
criteria
ver con la
for
actividad
this
económica
stoplight.
y sus consecuencias sobre la actividad o la economía social
We did
en
delve
esta
into
región, y
the
el maestro Zoe
particular
Robledo, acompañado de sus
activities for
colaboradores,
economy and
presentó
social growth,
nuevamente detalles
and Dr.
sobre el
Zoe Robledo,
lineamiento de
along with
seguridad
his
sanitaria en el trabajo.
coworkers,
El
they
propósito
presented
principal de
what are the
la
details
reunión
in
fue
terms of what
el
would be the
diálogo,
guidelines
recabar la
and the
impresión
details
que
to
tienen
stay
en
at
este
work.
momento la
The
jefa de
main
gobierno y los
purpose
6
for this
gobernadores
meeting was
y
to
buscar
gather information on
oportunidades
their
de
thought
no solamente
based
consenso,
on
sino
what
de
is the chief
trabajo
government
colaborativo. El área de la
insights and the other
megalópolis
governors,
es un
not to
área
only
que,
reach
desde el punto de vista
consensus,
de
but
dinámica
also
poblacional
to how to
y
deal with the
por
megalopolis
consiguiente
action,
de
meaning
dinámica
how
epidemiológica
in
se
our
comporta casi como una
how our
sola
social
entidad,
dynamic
aunque existen
and the
asincronías
pandemic
en la presentación
dynamic
de las
may behave
epidemias.
as a
Esto quiere
single
decir,
entity,
en el Valle
even
de
though they
México
might not be
tenemos una epidemia
synchronized
más
on
activa,
how they behave in
mientras
terms of
que en el
pandemics.
resto
For
de las
instance, in the
entidades
Valley of
federativas
Mexico, we
de
do
esta
have a
región
more active
apenas va
pandemic,
empezando.
whereas in the
No
rest of
les
the
voy a
state,
dar detalles del
in this
semáforo
region,
en
the,
específico porque
the
tenemos
pandemic still
planeado
starting.
que precisamente la
I
siguiente
will not
semana
go into the
el
details
tema
of
va a
the
ser
stoplight
semáforo.
particularly
Y
because we
está
do have a
programada ya
plan
una
for
reunión
next
el
week.
martes con
So
toda
we
la
will have
Conferencia
a
Nacional de
conference with the
Gobernadores
topic
por
stoplight.
iniciativa de la
It's
propia
already
conferencia,
scheduled
a quien le agradecemos la
on
iniciativa,
Tuesday,
y vamos a entrar en muchos detalles técnicos que iremos
and we
presentando aquí
do thank the
en la
initiative
sesión.
for the
Perfecto,
conference
muchas
to be
gracias.
held, and we will go
Bianca,
over the technical
usted,
details then.
y allá usted que no había estado, y por
Thank
allá
you.
Dulce Soto.
Gracias,
Bianca,
buenas noches,
thank
Bianca
you,
Aguirre de
and
Notimex
you.
TV. Doctor, pues obviamente esta semana
Good
se
evening,
vio mucha
Bianca from
movilidad en la
Notimex.
Ciudad de México. ¿Qué va a
Doctor,
pasar,
for the
por ejemplo,
past
con
week,
la alcaldía de
we did
Iztapalapa?
register
Tan
a lot of
solo el
mobility in
miércoles se
Mexico
volvió
City.
líder
What's
de
going to
contagios,
happen with
llamémosle así.
the
Hubo
municipality of Iztapalapa? Just
2.974 casos
Wednesday became
confirmados
the
en esa
leader
demarcación.
of
¿Qué se va a realizar, por favor, doctor?
transmission.
Y para el
We
maestro
did
Zoe
have
Robledo,
confirmed cases
en
in that
este
particular area. What are the
reconocimiento que
next
se busca
actions
hacer
there?
al personal
And for
médico,
Dr.
se habrán
Robledo,
también, por
in
ejemplo,
this
premios para todo el
recognition that you
personal que
are
está en
giving
activo,
to
este
the
personal
healthcare
médico que está
personnel,
en la
will you
primera
be
línea?
giving
Muchas
awards
gracias.
for
Buenas
them
noches.
that are actively working
Sí,
at the
por favor.
front line of this
Muchas gracias.
epidemic?
Sí, Bianca, la verdad que todo el personal, todos, incluso también y destacadamente también de los
Thank you very much,
que
Bianca.
quizá no
All of the
están
personnel,
atendiendo pacientes COVID, pero están atendiendo otras partes del
and
hospital, en la
of
consulta,
course,
o
even those who are
están
not at the front
trabajando en
lines
los triage,
themselves, but
o las
that they
TAOTS
are,
del Seguro Social
we
que
could say, the
atienden
back office who
a
are
los
still giving
familiares,
consultations
todos ellos forman parte
or
del
giving the
equipo.
different
Y en el caso del Seguro Social
lines
tienen
of
dos
the hospital
estímulos,
system,
dos formas de
taking care of
reconocerlos
family
que
members and so
forman
forth.
parte del contrato colectivo de
All of
trabajo.
them
Uno
are
es
considered.
los bonos,
And they
un
do
bono
have
COVID
two types
diseñado
of recognition
específicamente
and
para
stimulus
esto,
that has
pero
been
también notas de
presented
mérito,
in
que
terms of
como
their
su nombre lo
contract.
dice, es una
Number
nota
one is the
que
COVID bonus,
estimula
which was specifically assigned for this.
conductas
And the second
meritorias.
one is
En este caso, en
for
el Seguro Social,
good
a partir
work.
de ciertas acciones pueden llegar a acumular hasta 19
In
notas
this
de
case,
mérito.
for the
Cada
Social
nota de mérito
Security
más o menos son como un día
network,
adicional de
you can
aguinaldo
even gather
y es una
19
forma de reconocimiento
recognitions,
al trabajo. Pero eso es
and
para
most
todos,
of them
tanto el bono
are
como las notas
equivalent
de
to
mérito.
an
Y si me
additional
permite, el doctor
day for
López
the
Gatell,
Christmas bonus.
una muy buena noticia de
And
viernes
those are the
que se
two
las
lines
quiero
that we're
compartir.
handling. And if Dr.
Hoy
Gattel
fue
will
egresada
allow
la
me,
jefa
a
Fabiana,
very good
está
news
ya
for this
en su
Friday
hogar,
evening
le
is
mandamos
that
todo
today
nuestro afecto.
Dr. Fabian
Estuvo
has
hospitalizada
been
algunos
released
días,
hospital.
pero salió y
She's
está
at
muy
home
bien
now,
y
and
bueno,
we
la
hug
queremos mucho.
her from
Como
a
y
distance.
a ella
She was in the
y en su figura,
hospital.
en su persona,
She's
a
now
todas las
released.
enfermeras y
We
enfermeros
really love her,
del país. Pero
and
bueno,
we
era
really wish
la
this
respuesta del
well, not
programa.
only her, but her job
Muchas gracias,
as well,
ministro Robledo.
along with all the nurses in
Sobre
the
la
country.
movilidad,
But that's your answer. There
nos
you go.
quedan 8 días de la
Thank
Jornada
you, Dr.
Nacional de
Robledo.
Sana
In
Distancia,
terms of mobility,
8 días
we still
valiosísimos,
have
8 días
8
para no
days of the
desaprovecharlos.
safe distance
En
campaign,
todo el país
very
es importante
valuable 8
porque
days
es
so that
la
we
jornada
don't waste
nacional,
them.
es decir,
Across
la
the nation,
restricción
it's very
masiva
important
que, como hemos
because
comentado
that's
repetidamente,
where the name
estimamos que
derives.
podría
It's a
estar en
national
al menos
campaign.
76
It's a
millones de
massive
personas
decision
fuera
that
de
we
la
have taken, and
circulación
we do
del
estimate
espacio
that it will
público.
be in around
En la Ciudad de
76
México, el
million
Valle de
people
México, no solamente la
on
ciudad,
the
sino la zona
public
conurbada de la
area
Ciudad de
where
México
mobility
es
takes place. In the
aún más
Mexican Valley
importante, dado
specifically, not
que
in
la
city,
intensidad
but
de la
in its
transmisión
surrounding
de esta epidemia es
and
mayor
so
aquí.
forth. It's even more
Y
important
efectivamente nos
because
preocupa
the amount
apreciativamente
of
muchos
transmission that we have is higher here.
ciudadanos, ustedes
And we are
comunicadores
definitely
y también
concerned,
nosotros como parte del gobierno
citizens
identificamos o
around
percibimos
press
que
people
pudieron
and
haberse
government
relajado las
staff.
medidas y la
We do
gente empezó a
perceive
salir.
that
Aquí quiero decir 3 cosas. La
probably the
primera,
measures
la
have been
importancia que tiene.
not taken as seriously as they were before, and people
Mientras
began to go out.
exista este
So,
periodo
number
de
one,
altísima transmisión,
I would like you to
cuando
recap on
salen
the
las
importance of
personas
this
a la calle,
campaign.
tienen una
While
importante
we do have
probabilidad
a high
de ser
transmission rate,
contagiadas
when
o de
people go
contagiar a
out,
otras si es que
they
tienen
do
síntomas o
have a
tienen
high
la
probability for
infección.
transmission or to
La
transmit it
segunda
to
es,
someone
hoy
else should
precisamente
they have
con
any
los
type of
gobernadores y la
symptoms
jefa de
or anything
gobierno,
else.
comentaban algo que ya han
The second
comentado
one is
otros
precisely
gobernadores
today in the
y
meeting
quiero
that I
hacer
mentioned before,
un
we did
reconocimiento
go
a lo
over along with
razonable que me
other
parece su
governors,
inquietud.
and at this
Cuando
particular
nosotros
moment,
aquí desde el
I would
Palacio
like
Nacional,
to
desde la Ciudad de México,
recognize how
comentamos el
reasonable this
acontecer
concern
nacional
is.
y
When
empezamos
we
a hacer
here at National
referencia
Palace
de
in
las
Mexico
siguientes
City, we
etapas
mention
de
how
las
the nation
decisiones de
is
política
working,
pública de alcance nacional,
and we mention
puede
what
ocurrir
we
que
forecast for the
exista
next
un
stage
desfase
and the terms
entre la
of
realidad
our
que vive
national
cada
decisions.
persona, cada
We
familia, cada
may
comunidad
have
y
a
los
difference
distintos
between what
elementos
the
que hay que
reality is for
planear
each individual
con
family or
anticipación,
community,
que hay que
and what are
comunicar
the
con
different
absoluta
elements that
claridad,
need to be
con
taken into account
anticipación.
previously,
Ya ha venido
and that we need to
un señalamiento
and that
que
we need
hoy
to
se
communicate
comentaba en
them
la
very
reunión con
clearly
los
and with enough
gobernadores
time.
de la
And it
megalópolis
was brought to my attention
sobre
in the
lo
meeting
que
today
puede esto
with the
complicar a
governor.
veces la comunicación social en el nivel local. Porque,
How can
como un
this
ejemplo,
complicate
alguno
the
de los estados
communication
pudiera estar con una
towards a
epidemia
particular
apenas
group
en una
and
cuarta
towards the
parte del
society
inicio de
in
la curva
general?
epidémica
Some of the states
y
might be
nosotros ya
going
estamos
with a
hablando de los
pandemic that is
elementos del
at its
tránsito a la
very,
nueva
very
normalidad.
start,
Es complejo,
and
es
we
muy
are
complejo
already
que
talking
no
about
solamente encontrar
how we're
el
going to
punto exacto, el
go
punto
to our new
óptimo de
normality.
balance, esto lo
So
hemos
that's
dicho
quite
también muchas
complex,
veces,
not only to
aquí estamos
find the
hablando de dos
exact
bienes públicos
balance point, and that's
imprescindibles,
something that we
la
have
salud y
brought
la
up
vida,
before.
que son lo
We're talking
prioritario,
about
que quede
two
clarísimo,
public
son
goods,
lo
which is
prioritario,
health and
pero
life,
también el
which are
bienestar
our major
social y la
priorities,
economía. Y hemos dicho en todo
but
momento
also
que se trata
social
de hacer un
security and
balance. Nadie debe
social
confundirse
wellness
cuando
and
hablamos de
economy wellness.
economía, que nos
And
interesa la
again,
economía
we
por
want to
encima de la salud y
find
la vida. Quien
a
pretenda
balance
tener esa
in this.
idea,
When we're talking
le
about
invitamos
economy, we're not saying
respetuosamente
that we
a
are
revisar
going
la
to
información
prioritize
que
that
damos
above
todos
life
los
and
días
health.
aquí. Es un balance.
Whoever
¿Y
thinks
por qué es
that,
un balance? ¿Y por
I
qué esto no es
respectfully
menor? Porque
invite you to
existen
review what we have said
enormes
before.
cantidades de
For us, that's
personas,
just the balance, and why
la
this is
mitad
not
del país,
anything
que
minor at
viven al
all.
día,
There
que
are
viven al
larger
día,
groups of people, half of
porque
the
vivimos en un
country,
país
that are
extraordinariamente
living on a
desigual
day-to-day
en
basis.
términos socioeconómicos. Entonces,
Because
estas
we are
condiciones
a
de
country who
restricción
is
llevan a
facing
que las
great
personas que viven al
social
día
and economic
también tienen
inequality.
sufrimiento.
These
Y el
restriction
sufrimiento,
situations
la
have
restricción
pushed
de
people who
movilidad
are living on a
lleva
day-to-day
directamente
faces
que
to
las
suffering.
personas que viven al
And this
día
particular
no tengan
suffering,
su sustento
mobility
diario, no
restriction
tengan con qué
will lead
alimentarse.
directly for
Y llevado
those
al extremo, eso
to
también
lose
afecta
their
la salud
daily
y puede
provision
afectar la vida.
and not even may have food
Entonces,
to put on
es
the
muy
table.
complejo
So
dar
that
a
would
entender
also
esto
affect
porque
your
cada
health
quien vive
and
la
hence
propia
your
realidad.
life.
quien
So
tiene un
it's
familiar
very
en el
complex
hospital,
for us
quien ha
to
perdido a un familiar
be
por
sensitive on it
COVID.
since you have your
Es
own reality.
completamente
If you are in
comprensible
the
que su
hospital, if
enfoque
you have lost
sea
someone to
en el tema
COVID-19,
del
it's
sufrimiento que
quite
tiene.
understandable that your particular focus
Existe una,
may
desde
be
luego,
on the
completa
suffering that
simpatía
you're
y
going through.
empatía por el sufrimiento humano en este caso. Quien
And
no
of
ha tenido
course, we
enfermedad
express
en la
our
familia
great empathy
y quien vive al día y no
to
tiene
this
sustento
situation.
diario,
If anyone has not
sufre
have
una
it in the family,
angustia
and
extrema
whoever
de
lives
ver
on a
a sí mismo,
day-to-day
a
basis
sus
and do
familiares,
not
a
have a
sus
daily
hijos e hijas
income, of
no
course you
tener
have an
sustento diario.
extreme
Y también
worry
merece empatía y
on
merece
how you're
respeto,
going to
merece
survive
simpatía.
how by not having
Entonces,
your
es
daily
muy
income.
complejo, pero
And
hay
I
que
also
entender en todo
respect
momento
and show my
que las
empathy
dos
to those
cosas se tienen que
on that
cuidar
situation.
y que
So again,
en
this is quite
México y en el
complex,
mundo
but
entero
once again,
es muy
both things
difícil
are to be looked out
encontrar
for.
el punto
And in
exacto de
Mexico and
balance.
across the world,
Entonces,
it's very,
termino
very
diciendo lo de
difficult to find that
Iztapalapa,
particular
pues
balance
sí,
point.
efectivamente no
So
es
I will just
deseable
close
para
up
el
with
control de la
Iztapalapa.
epidemia
So
que las
you are
personas
right.
salgan
It's
de casa
quite
y el mensaje
undesirable
es
for our
completamente
pandemic
claro,
control
quédate en casa,
to
todavía nos
completely
quedan
keep
8
people
días
at
de la
home.
jornada
My
nacional. Y
message
termino
is very
diciendo,
clear.
cuando
Stay at
termine
home.
la jornada
We
nacional
still
de
have
sana
8
distancia,
more days
que será
for
el
this
30 de
particular
mayo
campaign.
próximo,
And by the time this
no quiere
safe
decir
distance
de modo
campaign is
alguno, por
over
favor
on
ayúdenos a
May
transmitir este
30,
mensaje, no quiere
this
decir en modo
does
alguno
not
que
mean, and
volvemos
please help
a la
me
normalidad y
communicate
que
this
salimos
out,
todos a la calle y que
this
salimos a
does
hacer todas
not
las
mean by
actividades.
no means
Ese
at
es el
all
propósito del
that things
semáforo.
are back to normal, that we
La
all go back
mayoría
in the
de las
streets and do
grandes
everything as
ciudades
if nothing had
amanecerán
happened.
el 1 de
That
junio
is not
en el
the
color
case.
rojo
Most
del
of the
semáforo.
major cities
Y esto
will
implica
just
que
wake up
continúan
on
las
June 1st
restricciones
on
de las
the red
actividades que
color, on the
ocurren en el
stoplight,
espacio
which
público,
means
tanto
that
laborales
restrictions
como sociales
on public
como
activities
escolares.
are still in
Entonces, que
place,
quede este mensaje
both
claro
at a
y lo
work
vamos a estar
level,
repitiendo por esa
school level,
razón
and
al
social
dar
level.
detalles sobre el
Let me
semáforo.
be clear
Está
about
bien,
this message,
usted.
and I want to repeat it so that I will
Gracias.
not give into
Primero,
details on this
felicitar al
stoplight as I said
maestro
before.
Zoe por este año que tiene a
Thank
cargo
you.
del instituto. De verdad, un trabajo
Congratulations,
verdaderamente
Dr. So.
valioso.
It's now
Pregunta para
1
los
year
dos,
that you
porque
are at the
esta es una
forefront of this
pregunta
institute. Your work
un
is highly
poquito que se
valuable.
combina técnica.
Doctor, and you as
Ver
well,
si es posible
this is a mixed
que pudiera haber
question
una
in terms of
reconsideración
technicality.
de que no se considere enfermedad de
Do you
trabajo
think it's
el
possible that you
COVID-19
might
de acuerdo a los
reconsider
lineamientos que emitió el Seguro
a
Social,
work disease
no para las
COVID-19
personas o los trabajadores que están
based
en
on
la
the
primera línea de
guidelines
batalla, ¿no?
issued
Sino para los
by
que
the Social
tienen un
Security
riesgo
Institute, not for
medio
healthcare
y
workers
un
and
riesgo
frontline
bajo,
workers, but
refiriéndonos
for those
básicamente
who
pues
are
a los
facing a
empleados
medium
de
or low
las
risk, meaning
peluquerías,
specifically
de las
for those
carnicerías, de las
employees
tiendas, todo micro y pequeño
that
empresario,
are beauty
justamente
salons,
porque
butchers,
estamos
or
hablando
any
de que
SME
no hay,
owner.
es una enfermedad que no tiene vacuna,
Precisely
es una
because we are
enfermedad que
talking
no
about
está en
that
manos
this
del
is a
patrón
disease that has
poder
no
decir
vaccine.
no voy
This
a
is a
implementar o
disease
voy a hacer
that
algo
it
para poderlo
has
evitar.
not
Estamos en una etapa de
been
pandemia
given
y el maestro Zoe
the
Robledo
power
sabe
to the owner of
que
the company
esto
on how we can
incrementaría la
avoid it
prima
or
de
even
riesgo de
take
trabajo
care of it.
para los
And Dr.
patrones
Robledo
del
is quite
próximo
aware that
ejercicio, ¿no?
this will
Entonces,
definitely
para los
increase
estos
the
trabajadores
amount
que
of money
no
they
tienen
give out
esta parte de estar
for the
en
next taxing year
primer nivel,
if they were
en
to consider
hospitales, etcétera,
COVID-19 in their
sigue la
payments.
súplica de hacer una
So
reconsideración
for
porque esa
this
sería una
particular
afectación
stoplight,
muy
do you think
grande
that there
para
is
los pequeños
a
y microempresarios que además
segmentation
de todo
point?
esto
And I
que han
do
sido
beg
solidarios
that
y
you
demás,
reconsider this
pues
because
se
it
vaya a
will be a
incrementar
huge
la
impact
prima
on
de
the
riesgo de
SMEs,
trabajo
plus
para el
the
próximo
people
año.
that have been
Gracias.
putting up with payrolls,
Muchas
and that
gracias
will
por su
definitely face the
felicitación.
first, this will definitely be the first risk
Justamente como
that
lo
we
ha
will
comentado
face
el doctor López
when we go
Gatell,
back to our
toda
working
esta etapa
activities.
se
Thank you
trata
for
de
your kind
balances,
word.
equilibrios.
And as
Y
Dr.
uno de los
Gastel has
grandes
said
equilibrios
before,
es la
this particular
corresponsabilidad.
stage is about finding a
Efectivamente, el
balance
Seguro
point.
Social
And one
podría
of those balance
tener una
matters
posición
is
respecto
how
a los centros de trabajo,
we can,
en
for
donde
example,
de manera
the IMSS can actually
coercitiva, digámoslo
respond to
así,
those working places
buscara
in
decirle a las
which,
empresas que en
you
caso
know,
de que
forcefully,
ellos
if
se
you
llegara
want
a
to
ver
say it so,
un
we can
brote, contagios y
encourage
demás,
the
efectivamente se
companies that
declarara
in
el
case
riesgo de trabajo, la
they have
enfermedad
an
del trabajo y
COVID-19
entonces el incremento
outbreak,
de la prima. Y es una facultad que no,
we
a
will
la cual no se,
definitely
no se
cover
puede
for that
renunciar.
particular break.
Pero en esta etapa, en este
And that's a
tramo
particular
reforma,
power that they cannot
es
give up.
clave la confianza.
But at
El
this
presidente lo ha
particular
dicho muchas
moment,
veces,
when
nada
we
por la
go
fuerza,
back,
todo por la razón. Y en este caso, la
trust
razón es la que debe de
and
privar.
confidence
Y la
is
razón debe de ser, sobre
vital.
todo
The
para las
president has said
empresas,
himself, nothing by force,
en los
everything through our
momentos en los que
reason
vayan a
and
empezar
common sense.
a
And so
retornar gradual,
SMEs
prudente y de manera
must
segura a sus
take into
actividades,
account
a
that
que se
whenever
hagan
they go
cargo
back
de
slowly
lo que
and
eso
safely,
implica.
the
Por
regular
eso es que
activities,
están
they
los
should look
lineamientos que
after
conllevan un
what that
protocolo de
means.
autoevaluación.
Meaning,
No estamos planteando
we
que,
have
que
all the
solamente se
guidelines
evalúe
that
todos y
have
cada
a
uno de los 78
self-evaluation
puntos
protocol
de comprobaciones que se puede iniciar,
that
porque
not only
queremos
looks at the
confiar en los
78
empresarios
points to make
que se
sure
hagan
that
cargo
everything is
del
okay,
cuidado, de la
but we
seguridad y
also
sobre
want to
todo, lo
trust
más
on
importante, de la
those
salud de sus trabajadores. En
CEOs
ese
that will look
sentido, creo que
after
si
the safety
tenemos esa
and the health
lógica
of their
de
workers. In
corresponsabilidad,
that
entonces
particular
no tendría
regard,
por qué
I
pasar
strongly
el
believe that
tema
if
de
we
la enfermedad
follow this
del trabajo. Pero tiene que
co-responsibility
ser así.
logic, then
Tiene que ser a
owners should
partir
not
de
pay more
una
for that
empresa, por
particular
ejemplo,
disease,
ahora de
but it has
estas
to be done
neoesenciales o de
in
las que van a
that
ser esenciales a
particular
partir del 1 de junio.
way.
Nos
For
han aclarado
example,
que ha
these
cumplido con
new
todos los puntos
essential
que se les está
activities that
pidiendo
are going to be starting on June
iniciar.
1st, if they
Entonces,
have stated
lo está
that
haciendo bajo
they
protesta,
fulfill
decir
all
verdad.
of the 70
Y
points
es
that
una
we
verdad que
demand for them
nosotros
to
estamos
reopen,
asumiendo
then
de
you are
manera plena.
knowingly
Si no
taking
trabajamos
that
así,
condition,
entonces
and
va a
that
ser muy difícil
responsibility has been held
garantizar
on our end
que el
fully.
retorno
If we
sea
do not
realmente
work
seguro
like
y
that,
sobre
then it
todo
will be
sea
very, very difficult
sano,
to
así
ensure
como la sana
that the
distancia,
return to activities
el
is
sano
safe,
retorno. Pero
not
es
only
parte de la nueva
safe, but
normalidad,
also
que
healthy.
cada quien
And
haga lo que
just
le
as we're doing
corresponde
a safe
y
distance
que cada
campaign, we
quien
need to have a safe return
realmente
campaign
sea
so that everyone can do
rigurosísimo
what they
a la
are
hora de emprender un protocolo, de
responsible to
declararlo y
do,
sobre todo de
and the
implementarlo.
owners should
Si
be
esto fuera,
extremely,
si esto es así,
extremely
no
demanding
tendríamos por
on
qué
how to
considerar
implement a
la
protocol
enfermedad del trabajo.
and to follow
Y
it.
esperemos que así
If we
sea
do
en la
so,
mayoría de
then
los
we no
casos.
longer have to consider this a working disease. And we do hope that this is the case for most of them. Thank you.
Riesgo de trabajo, como lo dice la compañera, que no sea o que no esté implementado como
How can you not consider this a working risk?
ha comentado que el 90%
Or
de
how
los
can we
mexicanos
not
nos vamos a infectar de
think
alguna
of it
manera.
as a working disease
Entonces,
if it
eso
has
pienso
been
que sí
said
sería un poquito
that
más
90% of
Pero
Mexicans
aquí
will be
estamos hablando
infected one way
específicamente
or
de los
another?
centros de trabajo. Y
So
los
I
contagios
think this would be
comunitarios,
slightly
aquí están los
unfair.
grandes epidemiólogos,
Well, here we're
yo
talking
he ido
about specifically
aprendiendo
at
nada
the
más,
workplace.
pero no necesariamente
The
ocurren en el centro
social
de trabajo.
transmissions
Es diferente que uno
are more
contagie de
their
manera
field,
comunitaria, en el
but they
hogar, en la
don't
calle, en la
necessarily
vía
occur
pública,
at your workplace.
en cualquier otro
It's very
espacio,
different,
y
like
otra
that
cosa es
you
que
are
el
transmitted the
contagio
disease
a
in the
partir
subway
de
or any other public
la
area
mala
that,
implementación de protocolos o
and
la
it's very
ausencia de
different.
los mismos,
It's very different
entonces un
when
contagio
this
se convierte en
transmission
un
is a
brote y un
result
brote
of a
genera
lack of
problemas y
protocol
saturación de
or
hospitales.
a
Nosotros
negligence
somos los
on the
primeros
protocol, and
interesados
hence you
en
have
que
an
eso no ocurra,
outbreak, and now
porque
you have hospital
partiendo que todos
saturation.
los
We
trabajadores de ese
are
centro de
the
trabajo
first
son y tienen
spokesmen to see
regularidad
that
en
this
su
does not
aseguramiento en
happen.
el Seguro Social, en el momento que
All
estos contagios
workers, they
ocurrieran
do
y en el
have
caso de que se pusieran
their
graves, nosotros
insurance
vamos a atenderlos.
reassured
Por eso este
by
equilibrio
the
es tan importante para
and
nosotros.
in
Pero en
case
ese
they
equilibrio,
were
en
to
este
fall
momento,
ill critically, then we will
bien
definitely
público
look out
que
for
se
them.
está
But if
ponderando,
we were
además
to
del
find this
bienestar y la
balance
economía, es
point,
por encima de todo
the
la salud.
social
Entonces,
responsibility,
por
other
eso es
than
que se tiene que hacer
health
esa
and
valoración.
wellness, is that we
Ahora,
need
en
to
el
look
caso en
out
el
for
que
our health.
nosotros tengamos,
So
a
this is
partir de
why
las
you need to
incapacidades y
have
de otras
this
evidencias,
particular
que alguien
assessment
no
in
hizo su
place.
trabajo,
Now,
aunque lo haya declarado
based
así
on
en la
the
autoridad,
different
entonces el riesgo de
leave of
trabajo no
absences
va a
that we
ser
may get,
opcional,
if
va
someone
a
did
ocurrir.
not perform their job despite of
Gracias,
them
maestro
saying they
Robledo. Le
did
damos
so
la
to the
palabra a usted.
authorities, then this
Procedemos
will
a
not be
Dulce
an
Soto.
option, this will be
Gracias.
enforced.
Muy buenas noches. Juan Hernández del periódico Basta de Grupo Cantón. Muy bien.
Good
Nada más
evening,
una rápida pregunta, rápida,
Juan
chiquita.
from Basta.
En el caso de los trabajadores de las Fuerzas Armadas, ¿cuántas, en este caso,
Very
condecoraciones
quick
están
question.
planteando que se entreguen?
For Army
Y bueno, ya
Forces
hablando
workers,
de condecoraciones, ¿estaría la jefa
how many
Fabiana en
recognitions
esta
are you
primera
planning
lista?
to give
Gracias.
out?
Chiquita.
And Dr.
La
Fabi,
distribución
be
es a
invited to
partir
this?
de cómo se generen las convocatorias y demás. Son condecoraciones para todas las instituciones, porque
I
cada
believe that the
institución pues,
distribution will be
tiene un número específico de
depending
equipos COVID,
on
de personal
what the
demás,
terms and
ya son
conditions
detalles
are,
que creo
because they
que
do have a
vamos a ir
specific number of COVID
desarrollando y
facilities
presentando
and so
aquí.
forth.
Y
And I believe that the details
no,
will
bueno,
be
yo creo que
developed
a eso ya
and
correspondería
presented as
justamente a
we
la
go
forma como
along.
se haga la convocatoria. No nos podemos adelantar a nada
And again,
todavía.
based on our terms and
Gracias,
conditions,
maestro
we
Robledo.
cannot go
Con
ahead
su
and
voto,
say anything
mire
else
usted
yet.
si nos da tiempo. Son las 19:54.
Dulce, and you,
Gracias,
if
buenas noches.
we have some
Doctora
time.
Lomía, quiero preguntarle cuándo podrían ya
Thank you.
presentar
Good evening. Doctor
la plataforma en
Alomía,
la que los laboratorios privados van a poder registrar ya los resultados positivos
when do
que
you
emiten.
think that you can
Si, no sé, el
present
próximo
the
viernes quizá ya
platform in
podríamos tener esos
which
resultados,
the
o
laboratories
cuándo
can present
estiman
their
que ya se
positive
puedan
test
sumar
results?
a la estadística de los casos, por favor?
If not now,
Es
when do you
posible que el
think
próximo
that the
viernes podamos
laboratories
estar dando
can
ya
be
un
added
primer corte
to
de
the
esta
statistics
plataforma.
of
El día de ayer
confirmed
la
cases?
plataforma ya
I
está
believe
lista.
that
Precisamente
probably
la
by
reunión del día
next
de ayer
Friday we
fue
can
para
show a
hacerles
preliminary
el
stage of
conocimiento
this
de toda la
platform.
red
The
de
platform
laboratorios, porque hay dos
is ready,
modalidades.
which is
Los
a meeting I
laboratorios
was
grandes que además tienen
at
cadenas
yesterday,
nacionales
and it was
están en
coordinating
capacidades de
with
poder
the
alimentar la
laboratory
plataforma a
network,
través de un web service. Es
because
decir,
some
son
laboratories that are
sistemas
quite large, they
informáticos
do
que
have all the
utilizan
facilities
en
to
lo
put the
particular,
platform in place,
simple y llanamente
which means
enviará
they have
los
the
datos
IT
que nosotros les
and the
estamos
particular
solicitando
software that
para
we
poder
use,
tener la información.
and that
Eso es bueno
particular
porque
software
será
will just send the
automatizado
data
y
that we are
será
requesting so that we
cortes
can have
guiados.
the information,
Los
which
laboratorios
is good
más
because it will
pequeños que
be
no
an
tienen
automated
esa
process and
capacidad
it will do daily
utilizarán sí una
reports.
interfase
The
en una
smaller
página web
laboratories
a
that
través
do
del cual
not have this facility,
identificarán
then they will use
los
a
datos,
different
las
software
variables
through
que
our
les hemos
website,
pedido para tener esta
and they
información.
will be
Ya el
notifying the
día de ayer,
data that
después de
we
la reunión, en el
request
transcurso de
so
la
that we
tarde,
can
ya
gather the
muchos estuvieron
information.
enviando la información, solicitando
Yesterday,
sus
after our
nombres de
meeting and throughout the
usuario, sus
evening,
passwords,
we
y
did
la
get
Dirección
some
General de
results from
Tecnologías de la
them, and they
Información.
requested their
Agradecemos,
usernames and
como
their
siempre, al
passwords
ingeniero César
and the
Vélez
general
por su
address for the
participación activa en
IT
el desarrollo de estos
department. We
sistemas.
definitely thank
Estará
you
entrando ya en estos siguientes
for
días en
your
contacto
active
con estos
participation
grandes
and
laboratorios para
engagement
empezar a hacer
in
el
the developing
anclaje
of
de
this
estos web
platform.
service que
And again,
empiecen
we already
rápidamente a
established contact with these
transferir la
laboratories
información.
so
Por lo
that we
tanto, en
can
ese
nail
sentido,
down these web
es
services
bastante probable que
that
la
they
próxima
can start
semana pudiéramos
transferring the
tener ya
information.
un avance de
So
este
in
corte.
that particular
Según los
regard, I believe
resultados,
that by
estos
next week we can present
para
some
comprobar si
advancements.
no hay duplicado, por lo que comentaba de que algunas de esas personas pudieron estar registradas al solicitar
Are you
atención
able to
médica.
confirm that there are no
Cuando comprueben
duplicate
esto,
results
estos resultados positivos se
on
van a
this
sumar
particular
a la
platform?
estadística oficial, o sea,
And once you
tendríamos más
confirm that
casos
the results
confirmados.
are not
Es correcto,
duplicated,
teniendo el dato
the
ya
confirmed
fehacientemente
test
registrado, además
will
en un
be
sistema
added to the
oficial que
confirmed
sería el
case
de la
statistic.
plataforma, que por
Correct. We will
cierto
add
es un
them up so that this
componente
will be
de
official
todo el
results
sistema de
through the
plataformas que en
platform,
su momento está
which, by the
registrando
way,
los
is
casos. Entonces,
a part
uno es un
of the
registro
different
oficial
platforms
que tiene
that
trazabilidad,
right
por lo
now
tanto uno
is
puede tener
looking
la
after the cases.
evidencia completa
One
para
would
poder
be a
notificar o
traceable
registrar
official
este caso. Y
website
efectivamente,
from
dado
which
que
we
ahora
can
sí en el
gather
registro vamos a tener
full
el
evidence
nombre
so that we
completo
can
de la
notify
persona,
this particular case.
podemos hacer un
And
match entre
totally, now
la
that
base de
we
datos
do
de
get this
laboratorios
data, we
privados
will
y
put out
la
their
base de
full
datos del
names and we
CISBEN,
can
que es la base de
match
datos
the
institucional.
database from the
Podremos identificar
private
los duplicados
laboratory
para solamente quedarnos con los casos
funds
nuevos,
and
además de
the
que
government
vamos
one.
a tener
And
ahora
then
la
we can just
variable
match
de
them out
sintomático,
so
es
that
decir,
we
si la
can
persona
isolate the new
cuando
cases and then
llegó
add
a
them to the
solicitar la
statistics.
prueba lo
And
hizo
again, we're going to have a
previamente
lot of
propia, es
people
una variable
without
nueva que
symptoms.
viene, o
If
lo hizo
people,
por una
when they
indicación
reached
médica, es
out,
decir,
did
se acercó al
not go
laboratorio
out there,
privado con una indicación de un médico que le
or
dijo
if they
hazte
had a
la prueba.
medical
Pero además la plataforma
referral,
registrará si la
meaning
persona
a
era
particular
una persona que
instruction
tenía
from doctor
síntomas
suggesting
respiratorios
they
o
take
si
the
no los
test.
tenía. A lo mejor solamente deseaba conocer si se había contagiado.
And then we can look at if the fact they were having respiratory
Doctor Gatel,
diseases before or
el
symptoms,
interés
or
público
if they
que
were
se sigue generando por
transmitted.
conocer cómo
And
se están
Dr. Gatel,
haciendo las estimaciones para proyectar el comportamiento de la epidemia, quiero
after
preguntarle
the
si
public
podría
has
explicar aquí
manifested an
con mayor
interest
detalle
in wanting to
cómo
know the
funciona el
behavior of
modelo
these pandemics,
matemático
could you please
elaborado
go
por
into
CONOCYT,
detail on how
justamente
the
para realizar
mathematical
estas
model
estimaciones, por
works
favor, y
by
cuándo
CONACYT
lo podría presentar?
Cómo no, con
precisely
mucho
to
gusto. De
trace
hecho, lo hemos
this
platicado
particular number, and when
con
can
las
you present it?
colegas
Absolutely,
matemáticas
we
y
have actually gone
matemáticos.
over it
Tenemos varios grupos
with
que han trabajado,
our
a veces juntos, a
mathematician
veces
colleague.
de manera
We
independiente,
do have
deliberadamente
several groups that
independiente,
have been working
y
sometimes
nos va a dar
together,
mucho gusto poder
sometimes
explicar esto. Estamos viendo si
purposely
incluso pudieran
independently.
acompañarnos o quisieran acompañarnos
And
algunos
we'll
de
be
ellos
happy to explain this will
pero yo creo que en
probably
el curso de la siguiente
think if
semana lo
you,
vamos a poder presentar.
if some of them, sorry, would like to come
Por favor.
and present this themselves, so probably next week for sure.
Si me permiten,
And then
que
you,
les comparto
please.
un video que les mandamos a Jesús de un momento muy emotivo
And
que
just let
ocurrió
me
hace unos
show
minutos.
a video
Perdóname,
that I
por
sent
favor. Ustedes Mañana le pregunto.
to Jesus of a very emotional moment that we had just a few moments ago. Let me welcome to the Monterrey Airport. We are arriving before our ETA. We were informed that we do have a group of nurses that are arriving to Mexico City to support our city. We would like to thank you on a personal level and on behalf of Volaris. We want to thank your help and support. We find this task quite noble. Me, at a personal level, I want to thank you for helping us and to be looking after each and every one of us. And the rest of our clients, if you empathize with this situation, nurses helping us, please, let's cheer them up because thank you. We strongly appreciate it. Thank you. And I offer you my sincere acknowledgement. You have all of my admiration. May you have a great afternoon. And thank you.
Son nuestros enfermeros de Monterrey que vinieron a ayudarnos, estuvieron trabajando.
Those are our nurses from Monterrey that are coming to help us. They were working in the different spaces allocated promptly to attend this situation.
Complicado del que pues ya hay investigaciones en marcha, logró mantener a su equipo.
I believe that even though one of them was going through a very traumatic experience, they actually managed to keep themselves safe and sane. They are back to Monterrey today, and their major concern was we didn't do our job. And I told them, you did above and beyond because this cannot happen again. Specifically because your willingness to come and help our city is the most and foremost symbol of our solidarity that definitely nurses and doctors hold in their own values. And this is why we wanted to share this with you. Thank you, doctor. Just in time. It's 8:01, and this is where the conference ends. And tomorrow we'll begin with you. Thank you.